My name is Amy Kane, and I am the Senior Radiation Therapist at the Cancer Care Center of York County. As a senior radiation therapist, I actually have a multitude of responsibilities. First and foremost, I am on the front line every day working with my coworkers, treating patients and delivering radiation treatment. But I'm also lucky enough to be able to use my experience and knowledge of radiation therapy. I've been in the field over 23 years, and I'm able to bring that to the center and work with our executive director and our physicians on a daily basis, trying to improve efficiencies and patient care, and also work on larger projects within the system. My interest in radiation therapy started when I was a junior in high school. A very close friend of mine was diagnosed with cancer, and I would go with this person to chemotherapy and radiation treatments, and I was able to see firsthand exactly what happened during a radiation treatment, and I just thought the technology and the science behind it was amazing, and the caregivers that were delivering the treatments were just very outgoing and friendly, and their expertise and knowledge was wonderful, and they were so happy to share that with not only the patient but friends and family. And I also have a love for science and technology, and it was kind of like a perfect marriage, being able to help people and fill my need for technology and learning and being in the science field. I've always gravitated towards cancer centers that are a little bit more community-based and smaller scale, but centers that also are able to offer the latest in technology. When I first drove up to the center here, it's kind of hidden behind the trees, and I just saw this beautiful building. And then when I came inside and met the staff and saw the environment, it was just so warm and comforting, and it was not sterile in any manner. It just made me feel right at home, and it just was a great experience. I think it's very important as a leader to be a very positive role model for change. I think change is good, and I've been fortunate enough to be able to hire people that are like-minded and have a very positive attitude and are in the field for the right reason. So we go above and beyond consistently on a everyday basis, but I think that's part of who each and every one of us is as a person, and I think that shows. And as a leader, I kind of like to encourage and perpetuate that. So that all that goodwill and good feeling just naturally flows right to the patient. We see patients every day for typically 4 to 8 weeks. When they come in after their consultation, they'll come in for a CT simulation where we set them up for their treatment. So that is as a therapist, your first contact with that patient, and you'll spend about an hour with them. So you do get to spend quite a bit of time for their first kind of technical appointment with us. And it's nice because we also see them when they start treatment. So we're there throughout their entire course of treatment, from the planning phase through the treatment phase, and we see them in follow-up as well. So it's nice to have your patient come back and look for you when they come for a follow-up appointment and give you a big hug and say thank you for all the hard work that you've done. So it's very rewarding, and you really develop a lot of friendships and share a lot of stories, and just it's like family. They come back to family, and they enjoy coming back, and we love to see them. When the patient first comes to our facility, it's very important, first and foremost, to make them feel welcome and at ease. And it starts with the physician during a consultation, which they provide as much information and expertise and work with the patient to decide if radiation therapy is the correct treatment option. Patients now are coming to us being more educated and having treatment options. So I think spending the amount of time or appropriate amount of time with that patient or as much time as needed for them to feel comfortable learning about radiation therapy and if that is a viable treatment option for them. Just giving them as much information to make an informed decision about their treatment course is extremely important. And once the decision is made by the patient to continue on to have radiation therapy, we work greatly as a team to coordinate care with medical oncology, actually with any doctor's appointments. We want the whole process to be as seamless and the least disruption in their normal daily lives as possible. So we work around other physicians' schedule, other doctor's appointments. We try and schedule patients at appropriate times during the day if they're working or if they happen to have children to make it easier on them. And we even say, your appointment's not set in stone. We want to work with you and let us know if you have a conflict because we can make this better for you. What inspires me the most about working at the Cancer Center is meeting patients and their caregivers and their families. They're actually some of the most inspirational people I can meet in my lifetime. They're usually very upbeat and positive, and we get to see them on an everyday basis for generally 4 to 8 weeks. So you really get to know their families and see them on an everyday basis and get to know them and share stories, and they really become lifelong friends. I just love my job here. It's the perfect job, and it's my most favorite job that I've had in my entire career. It's home. It's definitely home.